Journalist Bari Weiss joined Real Time with Bill Maher to discuss her thoughts on where we are at with the COVID-19 pandemic. Let's take a listen.
No, I'm done with COVID. I'm done. It's like I went so hard on COVID. I
remember.
Sprayed the Pringles cans that I bought at the grocery store, stripped my clothes off because I thought COVID would be on my clothes. Like, I did it all. I watched Tiger King. I got to the end of Spotify. Like, we all did it, right? And
no, we didn't all do it.
Well, here's the thing. A lot of us did do it. And then we were told, you get the vaccine. You get the vaccine and you get back to normal. And we haven't gotten back to normal. And it's ridiculous at this point. I know that so many of my liberal and progressive friends are with me on this, and they do not want to say it out loud because they are scared to be called anti-vax or to be called science denial or to be, smeared as a Trumper. I'm sorry, if you believe the science, you will look at the data that we did not have 2 years ago, and you will find out that cloth masks do not do anything. You will realize that you can show your vaccine passport at a restaurant and still be asymptomatic and carrying Omicron. And you will realize, most importantly, that this is going to be remembered by the younger generation as a catastrophic moral crime.
So Weiss's remarks, which I agree with wholeheartedly, were met with sharp criticism from others. Here's MSNBC's Mehdi Hasan's reaction.
Time now for what I like to call the 60-second rant. This week it's on COVID. Start the clock. On Friday, journalist Bari Weiss went on Bill Maher to say she was done with the pandemic.
We haven't gotten back to normal. And it's ridiculous at this point.
Oh, it's ridiculous, is it? On the same day that Weiss and Maher were complaining about our obsessive focus on COVID-19 and urging us all to move on from the pandemic, 3,506 Americans died from COVID. That's a higher death toll than on 9/11. In fact, that's the highest COVID death toll since last winter and one of the deadliest days of the pandemic so far. And it isn't just deaths. Hospitals are full. 3 out of 4 of them nationwide are under high or extreme stress. In Utah, they're hospitalizing unvaccinated under 5s, including babies. And look, the people who should be complaining right now are our overworked and burned out healthcare workers. But no, it's never them moaning or whinging about the pandemic. It's the Bari Weisses and Bill Mahers and Tucker Carlsons of this world. And as journalist Alex Perrine points out, the people in the press and on social media complaining the loudest about COVID-19 restrictions are at this point people for whom COVID-19 is just a thing they're sick of hearing and thinking about. I mean, my young children have handled this pandemic more maturely and less childishly than the likes of Bari Weiss, who I'm sorry can't go to as many indoor parties as she'd like to. Meanwhile, another 1 or 2 Americans died from COVID in the time you've been listening to this rant.
I'm not a big fan of that guy.
Okay, now leave my former colleague alone. Look, I think that what Bari is saying about people having fatigue is legitimate. And I think that a lot of folks did ramp up and do everything they were asked to do. And there were commitments made, perhaps unwisely, that taking the vaccine was going to be the be-all, end-all of that. That's a messaging mistake that was made up on high by the government, by the CDC. However, it also is immature not to understand that sometimes you learn on the ground and scenarios change. People didn't anticipate Omicron. Maybe they should have and shouldn't have promised so strongly, but here it is. And obviously the vaccine does not have the same effectiveness rate. So that isn't to say that when there's a war effort afoot and you get tired, you give up because circumstances change and the battle lines change.
I think we should have given up early in several of our wars more recently. I don't know about that. We should have called it quits on Afghanistan decades ago.
Fair enough. But the reality is that I think that Mehdi is right to say that there are still people that are in the thick of this pandemic and that a lot of people that are complaining are this journalist class that, like myself, who get to sit home and podcast from relative safety and not the nurses who are triaging the number of cases and deaths that are still extremely high, to Mehdi's point. It was like the highest death day in the course of the past year while they were having these conversations. Well, and I think that perspective is necessary.
I know, but it's very sad. We all wish people were not dying. I wonder, the 3,500, I bet, what do you think, 95% of those people were not vaccinated? And you know what? At some point, I support your right not to get vaccinated. You can take that risk. I think that's a foolish risk. I think you should get vaccinated. But how much... My nieces and nephews have to wear masks in schools for how many years? Because we're waiting for people who aren't going to get vaccinated. And we're like, at what point do are people who've been reasonable and cautious about COVID, they're going to be expected to do this for the rest of their lives? Because we will still have we can't do anything about cases. We can do a little bit, not very much. We can do something about deaths, but that's on those people, and I don't think it's fair. I really don't think it's fair to expect everyone to continue to halt their lives forever when if you're vaccinated, you're substantially protected, and that ought to be good enough.
Yeah, no, I think that most people, if they're honest with themselves, have made changes to their behavior based on new information that's coming out, right? Like for the first year of COVID, I didn't go to the gym, I didn't exercise, my mental health suffered, as did my waistline. And eventually this past year I said, I'm taking a calculated risk. I have the vaccine now. I'm not likely to die if I get COVID. I don't have other comorbidities. I'm going to go and I'm going to exercise. And I think that that's perfectly fair and legitimate. There is something about the way that Bari is framing this, though, as though she is under the thumb of something, if she's being oppressed in some way. I want to know what it is that Bari feels like she's still being prohibited from doing to go on this rant. I mean, I also was washing the Pringles. Then we learned not to wash the Pringles. I stopped washing the Pringles. I wasn't able to go to the gym. It was irritating. I got vaccinated. Now I'm going to the gym. I understand that
having to wear a mask in the gym is, I think, a pretty significant infringement.
I handle it okay.
I cannot breathe. I hate the mask. If we host this show together, you'll get the thing I hate the most is the mask. I just despise them. I miss seeing people's faces. I have difficulty I have difficulty communicating with people wearing masks. I can't. I have trouble hearing.
Well,
so
look, I gotta admit, I love being able to make a CVS run without putting my face on. But I know that's a personal problem.
All right, yeah. Well,
look, I think it's important to note a lot of people are going to find Bari's comments to be relatable because that frustration is relatable. But the frustration being relatable, I don't think should be an excuse for folks to lose focus of the fact that there are a lot of people who are still very much in the thick of this pandemic, people who are not able to insulate themselves as well as folks who are in the media class. And it's not just about, people are unvaccinated, let them die if that's their want.
That's very heartless. I don't want them to.
But not even that, but that it's a burden on the healthcare system and people who are not doctors and nurses who are still struggling a great deal. And they're also the healthcare providers for everybody else who is vaccinated and who doesn't have COVID.
That's true. That's an absolutely valid point.
So there are community concerns here regardless. Yeah. And I just would like the tone of all of this. I think it's legitimate to voice your frustrations. We're all upset. Like, it is tiring, especially for people who have kids and are dealing with that level of things. But I don't like the way it's being framed as this antagonistic thing where there's all these people who are forcing Bari, into the stockades, doing I don't know what exactly.
The epidemiologist crowd, the people who it's still a very the experts, the science. Some of that has gone away a little bit. Probably should have gone away earlier. There's still a kind of shaming thing by some people to be like, oh, why does that mask has slipped under your nose? We're all dead now. That's just ridiculous. It's just totally insane. It's absurd, and some people still act like that.
Yeah, I know. Look, there's a Karen energy that's always going to exist in any
We have to get rid of the Karen energy.
But also, man, it's like.
Don't say it. Don't say it. Don't say it. Don't say it.
Look, I'm not lecturing to people in public transportation and stuff, but if I have a choice of where I'm going to sit, obviously I'm going to social distance.
All right.
How about that?
All right. Well, we have to leave it there, but we'll be back with more Rising in just a minute.